Hey, let's welcome to the airwaves Dr. David Klein of the Stages of Life Institute. He is our preferred medical provider right here, and it's time to talk to the doctor today about menopause and weight gain.
You bet.
What does one have to do with the other?
Has everything to do with it. Okay, let's figure this out. Okay, you're getting older, you've gotten a bit older, and certain bits and pieces of your physiology have burned out. What does that mean? It means you're going through menopause or you've already done it. And all it really means to anybody is the fact that you don't have any more eggs to ovulate. Okay, that's all. It doesn't mean anything more. However, the body of a woman will start to deteriorate as a result of this in a predictable but preventable manner. So what will happen is as a woman gets older, okay, and as these eggs start to wear out, okay, your estrogen level will decrease and it'll drop to about, 0, let's say. Okay, and that's not a normal thing. Men, on the other hand, their estrogen levels increase with age. By about the age of 40, that man sitting across the breakfast table has a higher estrogen level than you do. Now, if that doesn't make you feel like less of a woman, I don't know what would. Okay, so your estrogen level diminishes with age. Your progesterone level drops to about 0 when you hit this perimenopausal area. Your testosterone level has already gone to 0. So when you have 0, 0, 0 on these hormones, guess what? You are in menopause land. Now, why does this increase your risk of any chronic diseases? Why does it lead to weight gain? Okay, and this is the thing that I find most fascinating about this. But estrogen, estradiol, estriol, estrone, there are 3 of them that are important to human beings, human females. Okay, there are many other estrogens, but those are the 3 that we really concern ourselves with, are necessary for cellular metabolism, but also for the utilization, production, and sensitization to something called thyroid hormone. So when you have little or no estrogen, little or no progesterone, little or no testosterone, your thyroid can't work. If you don't have any estrogen, TSH, thyroid stimulating hormone, goes to 0. In other words, your body thinks that you've got an adequate amount of thyroid in spite of the fact that you can look at you, your temperature is low, your weight's up, you're depressed, your cholesterol went up, all of which are signs of hypothyroidism, by the way, okay, is all part and parcel of this issue with your estradiol having dropped to 0 or close to it. Now, your needs for estrogen are also important for osteoporosis, prevention of cognition issues, sometimes known as Alzheimer's, and heart disease. So your estrogen level is important. It must be maintained within a healthy, safe range. How do you determine this? Blood work. Okay, it's a simple matter. The blood work is not terribly expensive. Insurance, for the most part, covers it. Never done by saliva. It's got to be done by blood work. And then from there, you can adjust your medications to effect. Now, with hypogonadism, okay, ovarian failure, why does it lead to weight gain? Okay, well, if your estrogen diminishes, your insulin level will go up also. Okay, now why would this happen? What you do is you think about these hormones as not working individually. One hormone, one effect. One hormone, one receptor. They all work at the level of the cell nucleus. What does this mean? It means they make certain genes fire. Okay, there's only one cell in the body that has no nucleus. That's called the red cell. The rest of the cells in your body all have receptors to these hormones. Estrogen, vitamin D is not a vitamin, it's a hormone. You have receptors to that. Testosterone as well as thyroid. So if any one of these hormones is missing, many, many different types of tissues will become dysfunctional. So you will see people gain weight and they'll go, well, it must be my thyroid, but my doctor tells me my thyroid levels are normal. Well, did they check your estrogen? The answer is probably not. If they did, what would they find? They'd find, well, gee, it's within normal range. What's normal range? 0? It's typical to find an estrogen level of 0 in somebody who's a female who's 50 to 55 years of age. That doesn't make it normal. It doesn't make it healthy. It makes it typical. Why? Because most females have levels of 0 unless they're treated. So what do you do to treat these hypogonadal states? What do you do to treat menopause? Well, a lot of women out there say, well, my doctor gives me these pills. Well, marvelous. Okay, if you want to be treated like a second-class citizen. When you take the estrogen pills by mouth as your sole means of absorbing estrogen, okay, it leads to the increase in something called sex hormone-binding globulin. The same thing is true with oral progesterone. Okay, when you take these things, it hits the stomach, goes to the liver, induces the production of a protein that binds it up. Your body wants to protect yourself from it. This, in turn, makes it harder and harder and harder for you to be treated, but it also makes that little bit of estrogen that you have floating around to be bound up to a protein like a fly-on-fly paper. Okay, so what do we want to do? We want to replace those estrogen levels to where they need to be when you are, let's say, 35 years of age, to pick a number. Could be 33, could be 32. I don't really care. You don't even really care. But I don't want my hormone levels to be replaced to when I was 55 or 60. I would much rather be a 30-year-old man. You want to be a 30-year-old female. Knowing what you know now, you'll be dangerous. It is a good thing. So weight loss, estrogen levels, progesterone levels, testosterone levels, and the same thing is true with men. Men go through something called andropause, where their testosterone levels diminish, but their estrogen levels go up, and they too get fat. Why does this happen? Because estrogen causes people, cattle for that matter, to get fat. Okay, so why are you heavy with a low estrogen? Has something to do with the thyroid. Why is the man heavy? Has something to do with the insulin and estrogen. It's all the same. You know, we're all different. Okay, we're all. What's that with Yogi Berra? He said we're all unique. We're all different. Okay, so here's how it works. It's all the same. It's just a matter of how your imbalance is a little bit different from your spouse. Little more.
When people are not going to the doctor, and many of them aren't because of insurance or problems or cost, how are they getting anywhere near the readings that we keep telling them every week, 5 days a week, they need to get?
Okay, well, for starters, people think that healthcare is miserably expensive. Well, it isn't. News flash, okay? Here's how it really works. Medical care isn't really expensive. Health insurance is really expensive. So if you confuse health insurance with health care, you deserve to stay sick. Okay? Health insurance is a head fake. Okay? Just as your car insurance is a head fake. When you get a scratch in your door, you don't use your automobile insurance to fix it because you know your rates are going to go up. You think it's any different in health care? Because it really isn't. Okay, so what do you want to do? The blood work that we're talking about here may cost $100, $150, $200. Well, that's certainly not out of most people's price range when they're used to spending $600 to $800 on health insurance. So here's how it works. You can either spend your money on health insurance and get little or nothing,
right,
or use your money wisely. So an insulin level might cost $30. An estrogen level might cost $30. Few of these lab tests cost more than $30. In aggregate, you might need $200 to $300 worth of lab work at the very least. You know, I mean, so you're not talking serious money if you walk in and you pay cash for it. If you want to go ahead and try using your insurance, guess what? That's when things become expensive.
But this goes back to the disconnect. We had a great show about 5 months ago, and that's the total generation disconnect that people think, I can't even go to a doctor without insurance. It's crazy.
Oh, but it is what it is. Okay, so people ask, well, gee, you're not on my insurance policy or whatever, you know, so I can't come to see. I'm thinking, okay, if you want to take a flight to visit your kids up in New York, what insurance do you have covers that? None. You want to take a cruise? What insurance covers that? None. You go to the grocery store. When you go to the gasoline station, these are cash transactions. You get used to it. Okay, if everything that you did had to be metered, monitored, and paid for by some third party, you'd find everything would get much more expensive. So the lab work, much of which, if you go to the big labs, would cost $2,000 to $3,000. In my office, it's $300 to $500, okay, or less. Okay, $30 to $50 for single tests. It's not a lot of money if you do it thoughtfully, and if we do it locally. It's when you go and try to use your insurance and go to the big companies that we all know and recognize so well because they pop up like so many McDonald's, then you're about ready to get sticker shock. But frankly, if you want to go to get an MRI, go to the hospital, it costs you a couple $1,000. You pull out a wad of cash, it's $200 at the local MRI center. That's the difference in the way these things work. $250, $200 for an MRI, or $2,000. What would you rather pay? And it's surprising the number of idiots we've got coming through who take a moment or two to think through and they go, but I have my health insurance. So you deserve to spend that $2,000 next patient.
There you go. And I think it's only this show right here on the 2 stations we're running on right now. And I think Rush Limbaugh talks about it oftentimes, that he goes and pays cash for all of his health care. And he's got insurance. You bet he does. Okay, Robin, if we want to bring our money and go to the stages of life and spend it on nutraceuticals, health tests, screenings, blood tests, we can do all of that.
Of course you can. Look us up on the web at stagesoflife.net or on Facebook at Stages of Life Medical Institute. And you can always give the office a call, 407-679-3337. Hours, Monday through Thursday, 8 to 5. We're located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434.